Thank you, Dara, for your kind introduction and for the opportunity to speak at the research conference. Obviously, on behalf of RSM Ireland, we're delighted to be part of the NCSE research conference and to have the opportunity to speak to you about the work that we undertook for the NCSE around the area of review of education provision in adult daycare services. I suppose just briefly, I thought it might be useful to introduce everyone to RSM International. We're the Irish representatives of RSM International, which is the sixth biggest network of professional services firms of its nature. We have a presence in 120 countries and we have 48,000 staff worldwide. And then closer to home, I suppose RSM Ireland is a top 10 firm of accountants and business consultants. We very much focus on the mid-market client base, sort of both domestically and internationally, and we focus, I suppose, also on sort of the public sector and the not-for-profit sector. We currently have 12 partners and about 150 staff, and in terms of our range of services, we provide audit, tax and consultancy services, and really it is our consultant team that were involved in the conduct of this review on behalf of the NCSE and the many other stakeholders that were involved. And obviously we're delighted to have reached the stage today when we can present the findings. And really on that point I'll hand over to Dr. Rachel Iredale, who will take you through the key matters arising from the presentation.
Thanks, Terry, and good afternoon, everybody. So I'm going to do three things. I'm going to talk a little bit about the review and why it was undertaken. I'm going to give a little bit of detail about how the review was undertaken and some of the challenges around conducting research of this nature, and then draw out towards the end some of the implications. So you'll all be aware that New Directions is almost 10 years old at this point, and it really was a report that highlighted the striking differences in people's experiences of services, and it really did underline the need for quality assurance systems and support for providers to help them achieve common standards. And that was part of the rationale for undertaking that review, because in those 10 years, what the research evidence has consistently shown is that post-secondary educational outcomes for adults with disabilities were still poor and continued to be poor, and there were particular challenges around the successful transitioning from schools into other services. So the purpose of the review, so we were interested in three key things. So obviously we wanted to review provision, what was happening in terms of educational and learning programs in day services for adults with disabilities who have left school. We wanted to explore how those services were delivered and what outcomes are being achieved. And we're going to come back to that word outcomes quite a lot in this session. But we are also interested in assessing overall provider commitment to lifelong learning and the implementation of personal care plans, and to see to what extent they were being rolled out across the sector. So our research questions really focused around 7 main areas. So what good practice guidelines, policies and standards exist nationally and internationally in educational provision for adults with disabilities in day services after they leave school? And what are the key principles and the indicators, the metrics that are important of good educational practices in these documents? We wanted to see what the range of services made available were and what type of provision is offered to support adults with a variety of disabilities, both in terms of the type and severity of disabilities we were interested in when they leave school. We wanted to see how exactly educational provision is delivered in these services, and we wanted to see what the expected outcomes for service users were being achieved. And most importantly, as with all good review of any sort of service delivery, we wanted to see what could we learn from the research about educational provision for adults in disabilities and what could be rolled out in the future. So in terms of method, we had a number of ways that we were collecting information, and we triangulated all of these. And just very briefly, we started off with a very broad-based literature review that was desk-based, and we looked at different sorts of research, published research, grey literature and policy documents in both Ireland and other countries. We conducted an online survey of day service providers right across Ireland, and we undertook a stakeholder consultation where we did one-on-one interviews with key policy personnel and also representatives from different disability organisations across the country. Importantly, and I'm going to go into a little bit of detail about this, we undertook a number of site visits to 20 adult day services. So we're really interested in embedding ourselves into the depth of what was happening on a day-to-day basis to see what was really occurring in some of these services. And each site visit to a day service centre involved some one-to-one interviews with staff, both managers and ordinary personnel. We also did one-to-one interviews with service users, and we did a whole load of participant observation, and we reviewed all the relevant documentation according to a checklist that we had produced, so that each centre was issuing us with fairly consistent and fairly similar documents that we could compare and contrast. Our data collation and analysis was undertaken according to a thematic analysis approach, and we used a kind of standardized coding framework to draw out some of the key themes that were of interest to us. The synthesis and reporting involved regular presentation of findings to the NCSE and also to the advisory group who were working with us at that stage, and we had many iterations of those, and we're just have finished writing the final report. So in that first phase, which was as I said, the literature review, a lot of the desk-based research, what were the discovery findings that were of interest? So really what we wanted to do was profile the sector, and this is quite useful to see what the sector looks like 10 years from New Directions. So we think there's between 70 and 90 organisations providing day services in between about 800 and 1,000 locations, and I'm going to come back to the point later on about why we can't be really precise about some of those numbers. About 70% of the organisations providing daycare services in their settings are run by voluntary organisations. 44% exclusively provide services to people with intellectual disabilities, and 20% exclusively offer support to people with mental health difficulties. In terms of the data that we also collated, we think there's about 20,000 adult users with disabilities. 59% are male, 41% female. 89% of an intellectual disability, 11% with a physical or sensory disability. Most users are aged 45 plus in terms of day services, and this comes back to the point about the transition point from school into day services. What we discovered is most of the users of daycare services are slightly older. More adults with intellectual disability are male, and those with physical and sensory disabilities, they're more likely to be female, with slightly more, 54% are women. And we discovered about 1,200 school leavers every year start attending day services. So the throughput of new people coming into day services, it's consistent year on year. And we also found that day services are distributed across all of the 9 CHO areas. I won't go through this slide in any great detail, but just to note where the high percentages are, certainly down south, Kerry, North Cork, and in the more urban areas. So it is as you would expect it. Interestingly, we did discover that the HSE is named as provider in 58 settings or so, or about 6% of the total. So probably the most interesting thing that has emerged out of this research, and this is how good research is conducted, is by doing a really robust analysis of the literature, by looking at good practice in other countries and to seeing what's existed in policy documents. What we've done, which is quite novel, is we've been able to put together a good practice framework for how adult day services should be reviewed, which we're going to suggest is taken forward in many ways and in different settings. But what we want to point out today is that this framework, the good practice framework, really sets out the expected standards that we are requiring our settings to have. And it really includes a hierarchy of criteria that are important, that are objective and are consistently agreed as being good things, and a whole set of sub-criteria that really focus on what matters to service users and what really are the things we should be looking at when we're reviewing day service provision. So it's a mechanism to identify good practice, but equally important, it also helps us identify areas where improvement is needed. So each element of the good practice framework is grounded in evidence. There's an appropriate descriptor of what it looks like in practice, and it offers a really structured way to capture how an organisation is doing, what activity is undertaking, and really look at the whole approach to education and lifelong learning for adults with disabilities. So we had various different iterations of the good practice framework, and we refined it on an iterative basis, and we took account of feedback from various organisations, from the advisory group. We went out for consultation with stakeholders and obviously to the NCSE as well. So the good practice framework, just to repeat, it's novel in that it delivers for the first time a really robust structure for assessing practice in education and lifelong learning in adult day service centres. So here you can see what the framework looked like. I've very much just summarised the key details. As I said, in the report, which is going to be available soon, we're going to see all of the descriptors and how we came about putting this evidence together. But you can see the 4 different criterion that are important. So number 1, it's really important to ensure that service provision is person-centred. I mean, that is the fundamental thing that we should be pursuing. Number 2 is about outcomes, and I said earlier on we're going to be quite precise in how we talk about outcomes. Outcomes are about change. Outcomes are about a journey towards achieving something different. And it's really important that when we look at service provision, we don't just look at activity and describe activity, but we focus on the changes that are being brought about, the outcomes that are being facilitated for different people. So this is a quite important distinction in how we talk about how things are provided. We're also interested in staff capacity and capability to deliver education provision and how they view services and their buy-in to the underlying philosophy of being an outcomes-focused organisation. And obviously we need to look at organisational culture as well. In any organisation, when you have a group of people together delivering services, things can be shared successes or shared failures. So I'm just going to go through some of the other research that we conducted alongside the good practice framework, because it does help us think about when we triangulate our results and when we gather together all of the different ways we undertook research in this review, it really makes our findings more robust. So I did say we tried to do an online survey. We sent this out to all providers of day services. Unfortunately, the response rate wasn't very high, so we can't really regard this part of the research as very representative of what happened. However, it still offered insights into the type of activity offered in a range of settings across all CHO areas, which was good. We also got responses from all organisations of different types and sizes and with a variety of service users, both in terms of age, gender and the nature of their disability. Overall, what we found from our survey is that most respondents were delivering at least one programme under all 4 of the categories of support as per the New Directions report. So about 62% were giving support for accessing mainstream education or some sort of formal learning. About 64% were offering support for making transitions and for progressing. 70% were offering support for maximising independence, and 78% were offering support for making choices and plans with individuals. So all of that was great news. In terms of just breaking down some of the specific examples of support, the most common support programme provided by in various different settings was programmes on personal care that help develop life skills for adult users. So at least a fifth of settings were offering this sort of thing, and those sorts of life skills were around grooming, hygiene, shopping or cleaning, those sorts of skills. Some programmes were offering a personalised level of support that facilitated individual action plans and helped service users achieve independence, and those supported inclusion and integration into community settings. We had other categories of support programme, including things like employability, formal qualifications, independent living skills, literacy and numeracy, and travel coaching as well, which is considered to be quite important. Some settings, not very common, included things like ICT, so technology training, leisure and psychological support also offered. So I'm going to spend a bit of time talking about the site visits and how they were utilised as a means of data collection and the sort of things that emerged from that. So as I said, just to remind people, what we did with each site visit, we had a checklist of documents that we asked each centre to send us in advance. So they were a list of key documents that included things like a mission statement, a vision statement, policies around management and governance. We also looked for their policies around developing person-centred plans. We looked at things like staff training. Basically, any policy document that existed in an organisation, we were interested in getting it, comparing and contrasting, and to see how complete it was and how regularly it was updated. We also had a guide for observations at each setting, and we kind of offered our researchers tips and hints on interactions with various different people that they would come across. In terms of staff interviews, we had a fairly standard topic guide, so we had a set number of questions that we were asking in each session, but we did allow researchers to kind of top and tail those depending on what they were uncovering. So there was the flexibility to explore relevant issues as they were raised, and typically we did at least 2 interviews per site visit. And then we also interviewed service users. So again, we did 2 of those per visit, and we had 2 different types of topic guide in terms of helping people understand the sorts of questions that we want to explore. And we put a lot of time and a lot of effort into really developing research materials that were fit for purpose, that were appropriate, and the people were, they were accessible and they were clear so people could kind of really understand what we were trying to do. So in terms of site visits, we did 20 site visits in total in 2019, and each visit was led by our partners in Trinity College Dublin and supported by a member of RSM Ireland. We made sure each site visit was arranged at a time convenient for all participants, staff and service users. We didn't really want to disrupt anybody's activities in any shape or form. And for safeguarding reasons, when we were on site, nobody was allowed just wander by themselves anywhere. We were accompanied to every interview by members of staff. And we made sure our research instruments, and they'll be available in the report as well, you can see examples of them, they were clear, they were easy to read, and they were tailored to the specific communication needs of the different people that we were interacting with. Here's just another example of how we did some of our consent forms. We had ethics approval from the Trinity School of Education, and we kind of put a lot of work into making sure we're considering all the ethical issues when we were conducting research of this nature, and to make sure that everybody who was providing us with written informed consent knew exactly what they were signing up for, how the research was going to be used, and that we guaranteed anonymity and confidentiality at all stages. So, in terms of what we found from the site visits and triangulating some of the other research that we put together, what we did is we used the good practice framework as a lens through which to look at everything. So we looked at the 4 criterion that we had, we looked at the sub-criteria as well, and what we were really doing is assessing what was happening through this lens of good practice to see, like I said, where good practice should be rolled out. We could think about scaling it up or making it generalizable, but equally being able to identify where room for improvement was needed. So, great news, we did find that most service users were supported to develop individual personal care plans, and they were supported in making their own choices and their decisions. Almost all the sites that we visited had those individual PCPs, and they had PCPs that were goal-orientated, and those goals included some sort of education and learning. So that was great. And a lot of the plans were very much tailored to what the individual service user wanted. So it could be that the plan was written in a diary format, or it was written like a list, or there was some sort of visual aid. So it was very specific to the individual service user. We found that most sites undertook a regular review of PCPs with the service user, and this was great. So the frequency with which those reviews took place varied. Some were formal, some were informal, but there was also evidence that changes were made to the plans where necessary as different individuals were progressing, so that was great. We did see room for improvement in 2 sites, though. In one site, they hadn't yet started to implement PCPs, and in another site, there was no evidence of PCPs at all. So according to our good practice framework, we would be suggesting that this is poor practice and pointing out, as I said, there is room for improvement. Pleasingly, we also discovered that almost all sites had well-developed links to outside colleges and outside training providers to offer a whole range of accredited courses. However, provision around the country was a little bit patchy, and we found that staff in some rural sites felt a little bit restricted in the training and the accredited certification options that they could offer some of their service users, just based on their location as well. So, like I said, a little bit of inconsistency around the country. We found in terms of outcomes that very good practice, and there was strong evidence to suggest that very good practice existed across almost all sites in terms of a focus on outcomes, and importantly, a focus on outcomes that were of value to the individual. We did find, though, in terms of how the outcomes that individuals wanted to achieve, all sites were very, very good at managing service user expectations about achieving those outcomes. So it wasn't the case that something would be achieved, immediately. And we found that sites did things like setting incremental steps or smaller sub-goals when it came to trying to achieve something. They were very good at setting realistic timeframes for achieving those outcomes. So we did find, in terms of the main outcomes for service users, we found that there was good practice in supporting users to gain employability skills, for example, to go on work placements and have work experience where that was a relevant outcome for the service users. And most sites demonstrated strong evidence of a focus on the softer skills and the development of those softer skills, such as communication, social skills, as well as wider kind of softer skills that focus on things like self-advocacy, independent thinking, and interpersonal skills. So the importance of outcomes is really evidence in this review of service provision. As I said, outcomes always are written in the form of a verb. They indicate, something active, a direction of travel, some change that needs to be brought about. So the important outcomes that we were discovering were things like an increase in social skills development, like I said, confidence building, or an increase in inclusion in the community. We were also seeing evidence of improved transition between specialist and mainstream services, and evidence of more opportunity for service users to try new experiences on an ongoing basis. We saw a greater exploration of what evidence means to people and how it can be achieved, and an increase in access to formal education programs in line with people's need and ability. The educational outcomes we were interested in exploring included, obviously, the academic achievement-related outcomes like literacy, numeracy, results in exams, but also things like attendance-related outcomes, happiness-related outcomes, and then those ones related to independence as well. So looking at issues like resilience, socialisation, use of assistive technology, and all the life skills that go with that as well. So underlying the whole narrative underneath this review is the importance of outcomes. They are the architecture that builds really the good practice framework, and they're the thing that really lies at the heart of service provision. So, talking to service users, it was really heartening to be able to hear about what outcomes mattered to them, what really matters, because that really is the heart of what service delivery should be about. So I've just lifted a few here from the report and have put some of them in their words as well. So to be able to try new experiences, one service user said to us, "The day centre has helped me discover my love for movie making. I've always loved comics and films, but I'm now able to make movies and films at the day centre, which is great." Another one wanted to participate in mainstream community-based training. Since I was young, she said, "I've always wanted to care for young children. This is one of my main long-term goals. One of the steps that I've taken to make sure I achieve this goal is to attend college and study social and childcare," and the day centre had helped her with that. Others talked about how they wanted to develop meaningful social roles, and talked about how breaking down that outcome, breaking down that goal was quite important. There are lots of steps that you have to take, he said, before you reach a goal. I work in a voluntary charity shop, and to get that job, I had to follow lots of steps. And obviously to develop wider skills. In one of our sites, a service user told us that they were taking part in a self-advocacy group, and the most important thing that they were getting from that was that they were just able to stand up for myself. So another aspect of what we uncovered from the site visits was staff capacity. So we did find that most sites had strong evidence of staff with the knowledge and skills required to support the lifelong learning of adults with disabilities. Almost all sites provided us with good evidence of training plans and different sorts of learning techniques that integrated a variety of appropriate activities for service users. We also uncovered the fact that some staff were organising their own personal professional development, and there were examples of staff who went elsewhere to avail of different sorts of training, and then they cascaded that external training and the information that they'd gained off-site back to colleagues on their return to work. We did see, however, room for improvement in some organisations needing to provide slightly more up-to-date training in a diverse range of learning styles. We did discover that one size does not fit all, and we need to have, like I said, a variety of appropriate activities for different learning styles, and that some of the training could be better personalised in terms of being better focused on different individuals' needs and abilities. Evidence of good practice was also clear in regular visits to day centres by external professionals such as psychologists or occupational therapists. However, we did see that there could be room for improvement for sites to improve communication with some of these external professionals in a better and more consistent and more frequent way. And finally, not all good news, we did see that there was room for improvement in formally documenting staff training, and we didn't see kind of budgets for staff training and development in every site. So we really would be suggesting that there is a need to ensure that all staff have their training needs and training plans identified annually. These are reviewed, and in turn they go about leading to a better experience for the service user. So, some staff perspectives. Again, hearing from, verbatim from staff really is quite important. So I'm just going to read out a couple of quotes from the staff that we had. So one staff member told us that we stress nothing is ever a failure, just an opportunity to learn at our day centre. This is why we put small steps in place to achieve goals. This makes the process seem much more achievable and less daunting. In terms of success, the most important thing is constant praise and encouragement. Another member of staff told us, a PCP allows service users to really focus on themselves and their own skills. These soft skills develop the most when service users are out engaging with the community. And again, we try to get them the best opportunity possible. It's about what they want from the job. One manager actually told us, it is really the ethos and focus of the centre to make sure that the individuals are making good, meaningful progress. If the progress is not in something that is meaningful to the service user, then it doesn't really make sense. So they're great words, because that really underpins, as I said, the philosophy behind each centre. So the fourth criterion in the good practice framework was the notion of organisational culture, and that's often a difficult thing to try and really get to the underneath the skin of when you go into an organisation. We did find that there, through our documentary review primarily, that there was evidence of a commitment to lifelong learning in the vision statements of almost all the sites that we visit. And there was awareness of this vision amongst staff and amongst service users, and to a lesser extent amongst parents and carers. We did find that there was a commitment to education and lifelong learning evident in most sites' government and management policies. And we did see examples of good practice that included things like a communication log that facilitated communication between staff and family Whenever there was an issue to do with the user, this sort of thing would be noted. And we had lots and lots of examples of good practice whereby parents and carers were invited into different settings to participate in meetings about PCP progress and to talk with service users where appropriate. We also saw very good examples of good practice in terms of being inclusive and having an inclusive culture within the organisation when parents and carers were also invited into events, particularly those that celebrated progress and showcased different sorts of personal development skills. And we had some great stories around that. So I just wanted to say a tiny little bit about the research challenges. So undertaking a review of this nature, as you can imagine, is quite challenging. The whole area is beset by the fact that there is an absence of a standard definition for some of the relevant terms that we were interested in looking at, and it's just not a problem unique to Ireland. I mean, this is it's international as well. But some of the terms like adult day service, lifelong learning, and educational provision, there were different views about what exactly these meant and different ways of defining them in different policy documents. We have in our report reviewed some of these different ways about how these things have been put together, and we have talked about what we've agreed the primary understanding of these terms is. We found some of the data sets that we were looking at varied as well. Some data sets focus on locations, some on centres, some focus on users. And some data sets were incomplete because, as you're probably aware, not everybody in Ireland who has a disability avails of or even requires a specialised service and therefore isn't included on any data set. And obviously the databases exclude adults with a disability who choose not to be registered on them. One of the data sets that we looked at didn't include anybody over the age of 65, and neither of the HRB data sets records data on adults who have autism unless they were concurrently also registered because they had an intellectual or physical and sensory disability. Probably the fundamental or one of the kind of thorny issues in relation to this, that some of the data reported for adult day service settings are often combined with other service provision and therefore cannot be disaggregated. So we had problems around disaggregation. So those people out there, academics who might be interested in the methodology, these were some of the things that we'll have to untangle going forward. So I just wanted to spend a little bit of time talking about the implications of this review and obviously what it means for things like policy, for things like the practice and procedures, and also for the people at the heart of this service area. I will say a point that the review undertaken by RSM Ireland was completely independent and objective. It doesn't necessarily mean that what's emerged and some of the implications from the findings are recommendations that NCSE will be taking forward, but they are things that we feel should be put out there in terms of things to think about because they have got important implications. So number one, as I've just said, was a data strategy, for example. Poor data quality, as you're probably aware, isn't a new issue. It applies to many of the areas covered by the HSE. But we did find that there was an issue around ownership and accountability. So in education and lifelong learning, there is a deeper issue. So the limited recognition that education and lifelong learning occurs in adult day services and the associated lack of ownership made it unsurprising, really, that people weren't motivated to collect data. So, as we discovered, if policymakers, if funders, if providers do not perceive adult day services as being about education and lifelong learning, it's unsurprising that the existing information is of poor quality. And I don't have to remind people, the better your data, the better your insight. So I shall just leave that there in terms of improving the quality of the data going forward. Some implications in terms of process. We heard this morning lots of really, really great examples from our panel of really fascinating things that were taking place in different educational settings, right from primary school up to primary. And I think consistently the panel said something along the lines of, we need to share good practice, we need to be better about sharing good practice. And this is one of the things that has emerged really, really strongly from our review. And we recommend that sharing good practice about education and lifelong learning, and examples of that really has to start taking place. And that could include things like putting together a library of tools and approaches, classified possibly according to the type of intervention or the target group that they're aimed at. We've come across a few really good case studies that have demonstrated the benefits of these different approaches as well, and we would suggest that sort of thing needs to be shared. Good practice is also shared through networking and contacts and providing mutual support to people, so it was really good to see that some of that was taking place. And obviously you need some sort of benchmarking tool. You've got to know what good practice looks like, what does success look like, in order to see the extent to which you're progressing towards that good practice. So we recommend our good practice framework. As I said, it's very much in the baby stages, but we recommend that more testing of the good practice frameworks take place in a greater range of settings, and it's done on a longitudinal basis. So we do it over time as services evolve and as they respond to some of the findings of this review. And just finally, it's to talk about some of the people at the heart of this. A fundamental premise that we have discovered is quite important is this notion of co-production, that if organisations are to be really successful with how they deliver day services, they must really understand and get under the skin of the needs of their services and engage with them closely in the design and the delivery of those services. Co-production rejects this idea of service users being dependents of public services. We heard this morning lots of examples of anything that kind of speaks of a deficit model just really needs to be avoided completely. And it redefines the service user relationship as one of codependency and one that is really collaborative, and we're really in favour of that. So it includes the experiences of both service users and staff through regular formal reviews of the effectiveness of different learning activities and what is happening in these centres. Importantly, and we didn't do this really in the review, but it does illustrate what the next step needs to be, is that we recommend engaging people with disabilities in the first instance to look at the framework, to think about it, to get their perspective on how it's being rolled out. And importantly, we think we have to seek the views of parents and carers directly about how they think about the framework and really whether what really matters to them lies at the heart of the framework. So I'm going to draw to a close. I'd just like to acknowledge, obviously, our colleagues, our research colleagues from School of Education in Trinity College Dublin, obviously the support that we've had from the NCSE and the Research Council in particular of the NCSE, and we had a whole advisory group who were helping us through the years that we've been undertaking this review. And I would just like to say thank you to everybody. We're going to have some questions and answers, but also if you need to contact either Terry or myself about any aspect of this review or any research of this nature, our contact details are there and we would be happy to help. Thank you.